Thank you very much, Jeff. Once again, it's delightful to participate in this excellent program. And today's going to have a constant theme which has to do with drug-resistant focal epilepsy, looking for alternative means of reducing seizure tendency and improving quality of life. This talk nicely will follow Dr. So's excellent presentation on neuroimaging and precede the excellent talks we'll receive in a few minutes from Dr. Warren and Dr. Sheth. My remarks will be restricted to the evaluation and treatment of patients with drug-resistant focal epilepsy being considered for neurosurgical treatment, and this is the perspective of a neurologist, like many of you, caring for patients who have medically refractory seizures that are physically, medically, and socially disabling. And once again, by way of disclosure, these are my personal and professional activities. When we see patients with seizure disorders, we should bear in mind that we have three goals. And I try to discuss this with patients on my first visit and constantly remind them as we're discussing either alternative forms of therapy or changes in the diagnostic evaluation or medical treatment. No seizures, no side effects, no lifestyle limitations. And these are oftentimes the goal the unique patient has to try to improve their quality of life. We know this is important because the single parameter that best predicts the patient's ability to be a participating and productive member of society is being seizure-free. And this is because of the putative beneficial effect: driving, obtaining an education, becoming employed, and living independently. So many of the issues that affect their quality of life are directly related to their seizure activity. We know that the economic burden of epilepsy is enormous, and much of this is borne by the individual with intractable seizure disorders. Over $12 billion each year in this country, and 2/3 of the costs are indirect. That's underemployment or unemployment, the need for a caregiver, and unable to live independently. Over 90% of the cost of epilepsy is related to patients who have drug-resistant seizure disorders. So this is a very important population, and we know how important it is in terms of quality of life to have early and effective therapy. Now, what are the adverse effects of seizure activity? And oftentimes we focus on the seizures when we talk with patients, which is appropriate. But if we look at the adverse effects of epilepsy in the United States, 25,000 to 50,000 individuals will die each year related to seizures or their causes. We know that these patients have a significant overrepresentation of cognitive disorder